Emergencies. Emergency cases usually generate more profit than regular ones, but in order to declare our clinic an emergency hospital, we do have to adhere to a lot of regulations. We choose another way. We extend our working hours late into the evening and weekends. This works because owners tend to notice emergency situations when they came from work and discover that their pet is terribly sick and needed help right away. If nothing serious happened before 10 p.m., they usually go to bed. Emergencies that occur late at night are rather rare, so by extending of our hours into the evening, we got a significant part of the profitable cases without having to go through the hassle of applying for permits. Of course, emergency visits require vet to have certain qualifications as well as well-coordinated efforts of the vet tech team, including the receptionist and the management. This is because payment can cause issue in case of emergency, as people might not be prepared for significant spending, and we do not want to refuse sick animals. On the other hand, we cannot perform those services for free. We have to think about materials and salary costs, so emergency work leads to complicated paperwork for assistants. We have to address each unique situation during the rather limited window. Have to figure out how we can help sick animals without losing money. On the other side, emergency cases can bring a lot of satisfaction to those who save lives. Yes, the routine vaccinations of puppy also prevent death from serious disease, but it's not as so satisfying as stopping severe bleeding, unblotting a bladder, and getting a heart restarted. Sometimes an emergency case may cause a smile. Other times it might induce a lot of sweating. On the 1st of January, many businesses are closed for New Year Day. Plus there is a huge storm, snow, and a few cars on the road. We have several patients in the hospital and a boarding facility full of dogs. They have to be fed and walked and medicine to be administered. No choice, I have to go to the clinic. I'm sure that the other employees will be able to, I'm not sure if other employees would be able to reach the office. I worked through snow up to my bones. Fortunately, all the other coworkers have thought the same thing and the whole team is present. Due to the weather, it seems obvious that nobody will visit us today. After performing the necessary steps to care for our in-stay animals, we are ready to take it easy, make tea, chat, have a holiday lunch together. As soon as this tea is almost ready, the first visitor comes, the mother and the daughter who drove their jeep, making a strenuous effort to bring us their female cat. What's wrong? It's an emergency. Our cat cried a whole night. Let's see what happened to the cat. We take a look. It's just regular heat. The doctor announced his diagnosis within a few minutes, but she has to be spayed. But there is no rush. It would be better if you wait until the heat ends and a less risky surgery. During heat, the vessels of the uterus are full of blood and might make the surgery much more difficult. No, we cannot wait, she said. Another night like this, and we will need to hire psychiatrists in our own sanity. Please help us. Extra money is not an issue. A few minutes later, another visitor walks in. His miniature poodle found leftovers from holiday dinner in the garbage bag, and the chicken bone is stuck in his mouth. The poodle can hardly breathe and is choking, coughing non-stop. The technicians prepare their surgical tools, anesthetic machine, and other necessary things, while the doctor puts his finger in the poodle's mouth. The poodle coughs especially hard, and the chicken bone falls off. The poodle is safe. A young couple steps and the entire floor is covered with snow from their coats. They bring in Chihuahua, and the dog is behaving strangely. Her eyes are moving quickly from one side to the other, and she is trembling like crazy. Her heartbeat is elevated. The only good thing, the dog looks happy. It's wagging its tail all the time. It's their 5th or 6th visit with the same symptoms, so no problem with the diagnosis. The young couple are fans of marijuana, and once in a while their dog eats their pot, which she finds in their apartment. We administer fluid therapy, detoxification, supporting treatments, etc. A nice-looking young lady with a boyfriend to match bring in her cat. The long-haired Himalayan is meowing, and his left side is covered in blood. The lady tells the doctor that this cat is beloved baby. She takes care of him and brushes his coat carefully almost daily. But today she found a mat under his left front leg. Her boyfriend suggests to cut this mat with the manicure scissors, and she agreed. One touch and a small piece of skin was cut off together with the mat. It was such a tiny stretch, explained the lady, but when I tried to clean it with the peroxide, the cut started to grow and grow. Now it's a big wound. Help him, please. It's no such unusual case. Many people think they can save money on cats grooming, doing the job themselves. When they cannot mat the tangled hair, they just cut it and often damage the cat's skin. The problem is worse because the cat's skin is very delicate, and any small cut can develop into big wounds. We're not talking about stray cat warriors here. Their skin is often hard as concrete. Sometimes it's even difficult to stick a needle in these street fighters. Sedation, local anesthesia, cleaning the area around the wound, numerous stitches, antibiotics, pain management, e-collar, bandages on the rear legs to prevent licking, and scratching of the C wound, and a bill. A boyfriend pays it. It looks like this payment would not be the only punishment that they given his poor advice. And so emergency visit the whole day. We even forgot about tea and lunch. Why could have imagined such a busy day and a stormy day, stormy January 1st?